we are under directed health measures and have now been since the beginning of, well, gosh, it's been the end of March, beginning of April now. And here I think we're sitting at about the 8th of May. The directed health measures that we're currently under right now in Sunday, May 10th, and we just received our new signed directed health measures that go into effect on Monday, May 11th. Basically, and I'm just going to give folks just an overview of what changed this week. So this week, starting Monday, May 4th, there were 2 directed health measures that were added to every county across Nebraska. And those included allowing elective surgeries to begin across the state as long as there was appropriate bed and vent usage available. So when I mean appropriate, it meant that a hospital had to have 30% bed availability, 30% ICU bed availability, and 30% vent availability within their health systems. In addition to that, all of the hospitals that started to do these elective procedures needed to have 2 weeks of PPE, which is personal protective equipment. So that would entail your gloves, your face shields, your gowns, and your face mask and those types of things. Also starting this week, so this will be the first weekend that these things will be enacted, was changes in regards to church services. So as you guys know, we hadn't been able to do a lot of church services here over the past 6 weeks. So effective Monday, folks could go to church or are able to go to church as long as they sit in household units. Each household unit is 6 feet away from the other household unit, and there's strict social distancing, really no communal activities, with different things being passed around, missalettes, money baskets, those type of things to really ensure the health and safety of everybody that was involved. In addition to that, there was some pretty strict guidance on cleaning and disinfecting between each church service, making sure door handles, light switches, pews, all of that kind of stuff was wiped down. So that will be something that I think we'll really see that for the first time, potentially tomorrow for some church services, Saturday night for those that do those, and then obviously Sunday morning. The thought process behind this is a lot of churches are able to communicate with communities. And so the thought process on the state level was getting some of that communication back out into the communities where we all live. So that was some of the thought process behind the church services. We're still getting questions on funerals, weddings, and those types of things. Funerals are now able to happen, still following, the household sitting together, but the receptions or the gatherings after the funerals, those are not allowed. Those would be still subject to the 10-person rule. And also the same thing with churches or with weddings. Weddings are now allowed to, but practicing the strict social distancing, but no receiving lines and no gatherings after the wedding. Those would also be limited to the 10-person rule. So that was really what went into effect Monday of this week, which would have been May 4th. So starting next week, we have three big changes. The first one is in regards to our restaurant and room dining. So basically what's going to happen now is starting Monday, restaurants in the counties of Dodge, Washington, and Saunders County, they are able to open if they are listed as a restaurant, right? So what this is going to mean is that they're going to be able to open at 50% of the maximum occupancy at any time. So if you're rated for 100, you're going to be able to open with potentially 50 people in there, as long as you're following the strict social distancing guidelines. And that means that each dining party has to maintain at least a 6-foot separation from the other dining parties. There are no more than 6 people allowed at one table. So let's say you're going out to eat with your family and there's 10 of you. Your group of 10 is going to have to split into 2 different parties there, and you have to sit 6 feet apart. Any buffets and salad bars are absolutely prohibited. We don't want any kind of communal dining activities. We don't want people touching the same stuff. So that right now, those are still prohibited. Each dining party must be seated at individual tables. There can't be any bar or counter seating utilized. And the only way that somebody can have a cocktail or a beer with their dinner or their supper is if they are eating a meal. So there's really no way for somebody to be able to come into a restaurant and, you know, have several beverages. They have to be eating a meal, you know, with that. So what we're trying to tell folks is, you know, this is small. It's a little bit of a minuscule change, but we had to start somewhere. We want to ensure that we are not completely overwhelming our health system, you know, by starting to do some of this. So that's why they're really small kind of bracketed changes. In addition to that, the restaurant owners or business owners have to have a system in place for ensuring that they don't have staff that are coming to work sick. So whether, you know, they have them sign a waiver that they're not sick, they check their temperature, you know, they're screening them, you know, however they want to do that, that's up to the business owner. And then also all of the servers working within these restaurants are also supposed to be wearing masks. So, you know, we realize this isn't going to be a small feat, but anything that we can do to really help with the health and safety of everybody while doing just these small baby steps to try to get back to some sort of normalcy is really what we're after. So that's really kind of the major changes, you know, within the restaurant in-room dining. The other thing that I just want to mention too is there's also regulations around disinfecting and, you know, what that looks like, and making sure that there's practices in place to ensure that that's being done regularly, you know, wiping things down that people might touch, you know, within our restaurants and those type of things as well. So that's really behind the restaurant and room dining that we're looking at going into effect on Monday. The other thing that has went into effect for us on Monday, and this is in regards to a barber shop, a hair salon, or nail salon planning to reopen on Monday. All clients and or staff working in any of these organizations must have a mask on. Each of these organizations too are limited to 10 customers at a time, and you must adhere to that 10-person rule is absolutely, that's instrumental. We can't go over the 10-person customer rule in there. And then we also have to ensure that, you know, you don't have, if you have people waiting to get in, we've got some social distancing, and that there's a way maybe to ensure that those, you know, that are cutting hair, doing nails, those type of things, have a way to make sure that their clients aren't sick. So we've had calls all over the board. We've had some that are just ecstatic that they're going to be able to open. They can't wait to see their clients. They are so excited. And then we've had the other side of it, obviously, where people are just think that was the goofiest thing they've ever heard of and can't believe we would even consider those types of activities. So what I like to tell folks in those circumstances is, if you're not comfortable opening, you don't have to. So that's kind of been our common theme there. Then last but not least, in regards to the last change, is the childcare. We're also limited to 10 kiddos a room. With these new directive health measures, they are going to be changing to 15 kiddos a room. So still trying to practice social distancing, you know, and doing everything that we possibly can to really ensure the health and safety, you know, of all the kids at daycare, but also allow for mom and dad to still be able to go to work, you know, by doing this. And that also ramps up the daycare's ability to watch a few more kids. So this week's been kind of a, you know, a pretty darn busy week for us. I know people are excited to have some changes, you know, something that shows we're trying to do something to really get our hands around what our caseload, what our case count looks like. Just to give you guys all an update here on our call, we are just doing case reporting now on Monday, Wednesdays, and Fridays, just because we're getting a pretty good influx of cases. So as of right now, this point in time, I had 8 cases yesterday, and I've had 3 cases that I've added today. One of the cases I've added today is a Saunders County resident, but Dodge County is at 148 cases. Washington County is at 23 cases, and Saunders County is at 12 cases. So I also want to remind all of you that while we are doing more testing, we are going to have more, positive cases. And I think that's something that we've talked about from the get-go. We didn't have adequate testing when we started this. It was really limited to you had to meet a certain criteria. So the ability to test more, that's a really great thing. So just ensuring that when you guys see that we have positives, we're expecting there to be positives, and just really trying to ensure that we're not overutilizing or overcompensating with our medical system. That's really that metric that we're looking at. So I think I talked a whole lot in a short amount of time. I'm known for that. Questions or something, anything you guys have for me. And I also just want to tell, and I know you guys all know this, Mayor Getzschman has been absolutely wonderful to work with. He wants the health and safety, of the residents within Fremont as well. I'm really lucky to have the terrific board that I have, but I feel really fortunate, especially within the Fremont area, to have the team and the community that we have. I know sometimes people might not always understand or agree with some of the decisions, but we really try to be as collaborative as we possibly can, and know that what we're doing, we have a lot we're trying to balance there, and I am trying to look at all different aspects of it, and put myself in other shoes, but just know that we're really fortunate, especially within the Fremont community, to have the collaboration that we do.
Without a doubt. Thank you, Tara. We are going to get to a couple questions in a minute, but I had one just for you quick. Can you just reiterate how important it is for folks to wear masks when they go out, and that the grocery stores that have the one way? I feel like we're not all kind of abiding by those laws, the rules that people have in place. So can you just kind of touch on the importance of that before we question?
Sure. So really, a lot of the stores have put some guidance in that they want you wearing masks when you come in. The masks aren't going to aren't going to keep you from getting sick with what that person has over there, but it is going to protect others from what you potentially would have. So that mask is really one more protected barrier, that you can utilize. The one-way direction at the grocery stores, and I have to tell you guys, it got me the first time. I was going down the wrong way. So I think that idea is we all just need to stop, try to be mindful, and pay a little bit more attention. I was in a hurry trying to do a million things at once, but the goal is then you're not meeting people coming and going the same way. You're having the flow go all one way. So if people could just be mindful of that. The other thing that I'll tell you that's pretty important too is my kiddos. I have 4 kids. My oldest daughter is in college, and I have 2 little girls still at home, and then our son's going to be a senior next year. My kids don't typically go shopping with me. So, if at all possible, if you can, you need to leave your little people home. You don't want them out there. You don't want them taking up extra room, but more importantly, I don't want my little people getting sick. So I think it's important that we're still trying to practice social distancing. I think it's important that we're not letting our kids convene together. My kids are going stir crazy, and it's a little bit difficult right now. But until we get here through the end of May and even get into June, you guys, where we know a little bit more, we all need to try to do our part to really still continue to flatten that curve, even with these small openings we have, as we move forward.
Thank you, Tara. I'm also going to turn it over to Mayor Getzschman just to chat a little bit about the city of Fremont, and as we start to reopen some things, or at least in small ways, and get smaller groups together. Mayor Getzschman, do you have any words of wisdom for the residents of Fremont, or anything that you want to tell folks?
Well, today's been a day of a lot of calls and people wanting updates and really wanting to know, should we open, should we not open? I really think it's a personal decision. Mostly the difficulty is for massage therapists and those people that are cutting hair and things like that. But I think all in all, Monday morning, you'll have an opportunity to get a haircut, which I certainly need. But I believe you'll be able to get a massage if you need a massage as well. I do know that they will do their best to be screening the folks that are coming in. We're certainly, just because we've relaxed a few things and the doors have been opened up a little bit, we're certainly nowhere near done. And certainly the virus is still out in our community and in full force. Testing is proving that. And again, I know Terra said some nice things about the mayor, but I think we've just got a great team and collaboratively, from the chamber through GFDC, through all the school systems, through the university, the YMCA, and we've all come together to make the decision. And Fremont Health has been at the top of that list along with Three Rivers. And I want to reassure everybody that we have plenty of capacity in the hospital. They've done a great job, and the Methodist system on a whole in Fremont and in Omaha has got plenty of capacity as well. So that was part of the reason why we were able to, as we discussed with the governor actually about 10 days ago now, Terra and I spent one whole morning discussing options with the governor in regards to opening up our community a little bit. And that's why we were, is because yes, we have a caseload that's growing, but we also have a hospital with plenty of capacity if need be. So in regards to the city, probably the biggest thing is again, the parks are open, but the playground equipment is closed until the 31st. And that's the same with the school systems as well. We need to, the kids need to stay off the playground equipment because none of that is being sanitized, nor probably will it ever be sanitized. I mean, it is what it is. But again, we need to be cognizant of that. Still, the social distancing is probably the key thing. The 10-person rule is key, and then the other thing is just if you're asked to wear a mask, wear the mask by all means, and if you're going into the grocery store, wear a mask. We as a company have been blessed. I'm not denying it. We've been able to work through this entire process, and we've also been blessed that none of our employees have had any issues with the virus, but we've been around folks that have, and again, we are now doing all we can do. If our customers want us to wear masks, we're wearing masks, and that's, I think, what the new norm is going to be as we move forward over these next 2 to 3 months. But with that, I think we will begin to see some lifting of, I know at City Hall, we're going to, we've discussed this week, we had a pretty strict ban that employees couldn't go to South Dakota, or they couldn't go to Iowa, or they couldn't go, and if they did, they had to be quarantined for 2 weeks. And we will be lifting that as we move forward. But we still aren't doing any out-of-state travel for conferences and things like that on the city side of things. So travel, I think, is still going to be difficult. My wife and I looked at Colorado. That's a state that is still closed down, and actually doesn't appear that it will open up to any extent in regards to hotels and restaurants, especially in those hot spots, till June 1st. So just gives everybody a little bit of an idea. If you think you're going on a vacation soon, you need to be making sure you're calling to ensure that wherever you think you're going is even open. So because there are many states just around us that aren't. So with that, thank you all for being on the call today. You know, it takes a community and a village to come out of what we're going through. You know, this virus is certainly one of those things that does not discriminate, number one, and number two, it certainly has affected all of us in regards to our economy and the impact of our community and our schools and churches, and it's something we'll remember forever. Certainly, you know, we kind of, people say we need to catch a break, and I'm telling you that day will come, but right now we just need to deal with this and get through it all together. So I'm looking forward to hearing how all of us plan on opening up. Just please abide by all the guidelines and please be safe.
Thank you, Mr. Mayor. We do have a couple questions for you, or at least one question for you, but I'm going to go back and get Tara's questions first. We had one question, Tara, that they've seen some question sheets for employees and it's borderline HIPAA violations. Do you have any recommendations of exactly what questions they can ask of their staff and what they should not be asking of their staff?
Yeah. I think the employee pre-screening, taking temperature and assessing for any symptoms consistent with COVID-19, there's no HIPAA violation, you know, with asking those questions. So do you have a fever? Are you short of breath? Have you lost your sense of taste or smell? You know, do you have any of those types of symptoms, headaches, cough? I mean, the idea is you don't want to have those individuals at work working for you. Then we end up having to do an investigation potentially linked to somewhere because we had, you know, somebody there working a shift that was sick and potentially passed it, you know, to several other people. So those type of questions aren't a HIPAA violation. Now, if you're going into somebody's medical history with pre-existing conditions and such, that isn't what we need to get into, but it is truly just the symptoms of COVID is what you're trying to assess. And also if they have a fever.
Thank you, Tara. The other question we had for you right now is, if an employee informs you that they have a fever, this company is currently requesting that they self-quarantine for 14 days. Do they still need to do that? And is there anything else that they should be doing?
Yep. So per our directed health measure, we're requiring anybody that, and this is actually signed regulation, right? So anybody who has tested positive for COVID-19 or who have the following symptoms: a fever of 100.4 or above, or a sudden onset of cough, or sudden onset of shortness of breath, or of course anybody who lives with or who have resided with people who have tested positive, they need to home quarantine from the 14 days from either that symptom onset date or the date that they had the last contact with the positive case. So, you know, if somebody has a fever, they have a cough, they've got a headache, you know, those type of things, really the best thing they can do is stay out of work, because we know that if they get those symptoms, it could be shedding there anywhere from 2 to 14 days after they start to show those symptoms, and sometimes even before.
Sure. Thank you, Tara.
Yep.
All right, Mr. Mayor, a question that I think a lot of folks and maybe young children in Fremont have for you is, do you have an anticipated opening date for the pools?
So that's extremely difficult, because certainly as we've went through this, we know we can't do anything through May 31st. So now we know, until we get the health directive as we go into June, and based on the governor's guidance, the challenge is going to be, is it 10 people in June still? No more than 10? Is it 25? Is it 50? And really, it all depends upon how well we behave right now. If we behave well now, that may allow more numbers to open up in June. But I really think that anytime we can have a volume that would allow us to possibly open Ronan would be first, would probably be July 15th. And our hope and prayer would be that we could open sometime in the first 10 to 15 days of July and be open through the first 10 to 15 days of August. But it may not be Splash Station. It may just have to be Ronan, and it'll be certainly social distancing and the whole separation, and will be directed primarily by the number of people. And again, if we never get above the 10-person rule, sadly, I'm afraid we're not going to have pools that open.
All right.
I know that's not good news. I'm sorry, but that's the best it's going to be with what we have right now.
Sure. Thank you. Does anybody else on the call have any questions for either the mayor or Terra? Going once, going twice. All right. Well, thank you again, Mayor and Terra, for joining us on the call today to give us kind of an update about what this week has looked like and then what next week has looked like. We encourage any business that has questions. I'm sure the health department is happy to answer anything that you have. I know they're crazy busy, so give them time. They have been amazing through this whole process, so thank you for all your hard work. And just continue to be safe, wear those masks, and do your social distancing still. Thanks for joining us, and we will have another educational session coming up very soon.
Thank you, Tara.
Thank you.
All right, take care.